Hi, I'm Dr. Shay Corbin, and I'm with MedSpine, and we're going to talk about knee and a little bit of basic knee rehab as we're going through. First thing we're going to do is start with stretches. We want to stretch the muscles that cross the knee joint, and so we'll start with the Fab 4 again. You can reference that in some of the earlier videos. We're going to run through it here real quick and allow you to do it with us though. So Brittany, straighten this leg out for me, and the Fab 4, we're going to start, this foot comes up, and we just do a straight leg. That straightness of that leg is real important because you're going to feel it back behind that knee. It's going to get that myotendinous junction of the calf and the knee, and the calf that are crossing that knee joint in the back. So then we're going to come out here and we're going to come out in adduction, and this will just help pull this calf and this other side of the leg as well. We always want to stretch those hamstrings. Really, really good for knee injuries because they are a big giant muscle that crosses the knee joint. And then we're going to go back over the other side for part 3 of the Fab 4. And then again, we want to tilt the pelvis up just slightly. We don't want to rotate it all the way. And then we pull that leg up this way. There you go, with that foot flat. You'll really feel this in that IT band and down that glute and outside part of the hamstring. And that really helps this knee as well. And you got to keep that knee really straight and that foot back. You'll really feel it good. And then as we come down for the 4th part of the Fab 4, we come up here, we really crunch that knee up, and then we come this way. Obviously, if you're having a lot of knee pain, be careful when you do that. This is supposed to be a stretch that's comfortable. It's not here to induce more pain for you, but you're gonna really feel that in the belly of the muscle. So from here, you're gonna do that on each side 3 times. So this is a good time to pause and run through the Fab 4, and then we're gonna cover the quad hip flexor stretch. So the quad hip flexor stretch is another big muscle that crosses the knee joint through the patella. And so we want to really get that hip flexor and that knee stretched. Sometimes if you have a knee problem, pulling that knee really close like that is going to cause pain. So if we're doing this, we want to keep that knee, that knee bend a little less intense, and we want to actually push the leg back with our glute. We'll actually push it back and pull with our arm so we don't bend that knee quite as much. And you really feel that in that quad when you do that, don't you, Brittany? Yeah, so that's the rest of the Fab 4, the quad hip flexor portion. And you'll do 3 sets on this side as well. So now's a good time to pause and finish your 3 sets of quad hip flexor, and that'll get you done. Next, we're gonna go to bridge. Bridge can be done in the basic bridge format for knees or the bridge with extension. It depends on your level of knee pain. If your knee pain is severe, we start with the basic bridge, which is both feet flat on the table, knees bent, basic bridge up, hold for 10-second repetitions. That's usually pretty easy. And so bridge with extension is what we really want to get to for people with knee problems. So go ahead and do an extension with this right side, and we keep those legs straight, and you can really feel that in that hamstring. It really fires that hamstring and starts strengthening it up and starting to stabilize the muscles in that knee. Switch sides for me. And obviously we want to do both sides because we want to really strengthen the knee. But if you have a lot of knee problems and one leg is much, okay, switch for me. One leg is much weaker than the other one, double down. The leg that's weak, make that one the one that goes down to the ground, 2-to-1 ratio until it feels about the same as the other, and then go to a 1-to-1 ratio. Okay, go ahead and pause, relax for that. So now go ahead and do at least 10 on each side, 5-second holds on those bridges with extensions. And we are gonna do seated straight leg raise. This you can do on the floor, you can do it on your couch, wherever you need to do it. Brittany, go ahead and sit up for me. And a seated straight leg raise is just what it sounds like. The more you're seated up, the harder it is. The more you lean back, the easier it is. So I like to use the arm of your couch. And then like if my arm of my couch is sitting here and I'm watching TV and the rest of my couch is over here, I'm gonna fling my leg over on that couch. I'm gonna lean against the arm of that couch, and I'm gonna do this seated straight leg raise about 30 to 50 times. So go ahead and show me that. And so that seated straight leg raise comes up and down, real controlled up, down, nice and controlled. Control that motion. You're gonna really feel it right here in the rectus femoris on that quad. It's gonna really help track the knee. And it's going to make that patella track so much better and reduce a lot of that patellofemoral pain that you may be experiencing in there. And let's go ahead and get 30 to 50 of those done. You can do each side, but again, if you have one side that's a lot weaker, double down on that, 2 sets to 1 set. And now would be a good time for you to pause and finish your set. And for the sink squat, it's really, for the knee, it's a great, easy way to protect your knee, because when we're doing a squat, we definitely don't want our knee to bend out over our toe. And so the sink squat is a great way to balance yourself and allow you to move back further away from angling that knee over the toe. So we're going to show you that right now. So Brittany's going to hang on to this, and the sink is great because you can grab the sink on the countertop. It's just an easy way for you to stabilize yourself and not fall backwards. So go ahead and do that sink squat. Remember, push that butt way out and then come up, and as she does that, go ahead and do about 10 of those for me. You can see that she goes down and she keeps that knee way back here above the ankle. And if you were to just do this without holding on to something, you're going to fall backwards. But that's the important thing when you got knee problems, is you want to keep that knee above that ankle as much as possible, so you don't create more trouble for yourself, but you're still exercising your quads, glutes, and all of that. And now's a good time to pause and do me about 30 to 50 of these. And then now we're going to go into a simple little stretch. We talked about stretching the quad and the hamstring that cross the knee. And we did a little bit of stretching of that calf with the Fab 4. This is, I call it the doorway stretch, because we usually do it in a doorway because it's easy to grab the frame of the doorway and put your foot up. But you can do it on the wall as well. So Brittany, get that foot way up there, bend down a little, and then, so yeah, there you go, and get that angle. And so now from here, what you do is you stand up straight, straighten this leg out, and then push your body, get that butt towards the wall, and you'll really feel that all back here in that calf. It just really stretches as you push that pelvis towards the wall and get up close to it. That's why I like the door frame. Really, really works. You want to hold this for at least 20 seconds. And again, you can do both sides, and you want to do at least 3 to 4 sets.